Today, we're discussing how to treat chronic pain. Medications have been the go-to treatment, of course, but there are other options available that provide relief without the consequences of prescription addiction. On today's show, we'll be joined by Dr. Adeel Haq, an ABMS board-certified, fellowship-trained pain medicine specialist on the medical staff of Texas Health Presbyterian Hospital, Plano. He'll tell us about some alternative pain management options that follow a more holistic approach. And that's coming up.
Welcome to the Wellbeing DFW podcast. Each week, Scott Sams will cover a different topic on improving health and well-being in our North Texas communities. He will host interviews with physicians on the medical staff of Texas Health Hospitals.
I'm Scott Sams. Thank you for joining us today. Many of us have experienced chronic pain at one time or another in our lives, and there's usually a quick solution: medication. It's fast, does the job. But in light of the opioid epidemic, medical professionals are re-examining their approach to treating patients who are in pain. Our guest today will talk about pain management options that provide relief without the possible consequences of addiction. Dr. Adeel Haq is an ABMS board-certified, fellowship-trained pain medicine specialist on the medical staff of Texas Health Presbyterian Hospital, Plano. He'll talk about some pain treatment alternatives that rely less on the medications and follow a more holistic approach to pain management. Doctor, thanks for being with us again.
My pleasure.
Doctor, last week we talked about opioids and the negative consequences. Following up on our conversation now, if opioids are causing such a problem, why don't you just cut back on the number of opioids that doctors prescribe? Because a lot of people think that way. Am I right or am I wrong? Tell me what's going on there.
Well, opioids are being overprescribed, no question about it. Not only are they being overprescribed, but they are being misprescribed. They are being used for indications that they really should not be used for. Hence, this is what led us to the current opioid epidemic. Now, when we talk about just cutting down opioids for people with pain, that's one way to do it, but you're not addressing the issue. Patients are still suffering from pain. A lot of these patients have been on opioids for years. To be very frank, it is not humane to just get them off. They're going to go into withdrawals, which truly is an emergency. So there has to be a methodical, stepwise approach on how we address this.
How do you do that?
So if I see a patient who's been on any opioid out there, 10, 12 pills a day, you may think that's an unrealistic number, but trust me, we see this on a daily basis. First of all, nobody should be taking 10, 12 pain pills a day. However, if they come to our clinic, what my approach is, I talk to them. Education is where it starts. These medications have a negative effect from head to toe. It can affect your immune system. It affects your endocrine, your hormone system. It affects the neurological system. All this data is out there. We know that these medications long-term have a negative effect. So once we are done educating the patient, you have to do what is medically right. So the approach we employ to wean somebody down is basically take them down 25 to 35% of their current regimen over 2 weeks. Then you go down another 25, 35% for a couple of weeks till they come down to something that is more manageable.
If someone wants to avoid opioid medication, just totally avoid it, to treat chronic pain, what are some recommended alternatives?
If I have a patient who does not want to be on opioids, I'm totally fine by that. So once again, the alternatives to opioids will depend on what the pain issue is. One of the most common pain issues that any adult will experience is neck or back pain. So if we get a patient with neck or back pain, the first thing we do besides getting a good history physical examination is to find out why they're hurting. Is it a mechanical issue? Is it a structural issue? So they need to have some imaging done. We can do that over here. Once we get the imaging done, we'll discuss that with the patient. Depending on what it shows, we can offer a number of therapies. Most commonly, when you're talking your run-of-the-mill neck pain, back pain issues, treatment starts with medications such as Tylenol, Advil, Motrin, and then you offer physical therapy, aqua therapy, or even chiropractic use. We do this for 3 to 4 weeks, and then we'll reassess the patient. Let me just back up for a second. If the patient is having neck pain, back pain with what we call some red flags, such as if they have an arm or leg weakness, if they have bowel or bladder changes, that may be a true emergency. Well, we can take care of that here as well because we have direct access to a neurosurgeon on staff here. So to answer your question, if they don't want to be on opioids, we prefer that. That's the way to treat pain nowadays. And it just depends on what the pain issue is and why they're hurting.
Doctor, I've heard of some very effective pain management options out there, including some that rely less on medication. What are some of these comprehensive pain management plans, and what do they consist of?
So generally speaking, when we get patients at our facility complaining of chronic pain, we really do a complete A through Z evaluation. Obviously, we do imaging studies. We may do some other studies to diagnose why somebody's hurting. But more than that, we want to look at their lifestyle because a lot of times lifestyle modifications can address chronic pain as well. Simply speaking, somebody, if they can lose 10, 15, 20 pounds, that goes a long way. We have a dietitian on staff who can offer some dietary suggestions. We employ physical therapy, aqua therapy, chiropractors on site to determine how to tackle the chronic pain. One other thing that I want to highlight, our philosophy, our approach at Texas Health Pain Relief and Wellness Center is focused on the individual patient. We have talked about general guidelines on how to address pain in a generic setting, but it really starts with the individual patient. It really starts by talking to them. We try our best to tailor a custom plan for that specific patient. To avoid patients from going to multiple offices for various services, at Texas Health Pain Relief and Wellness Center, we have assembled essentially a one-stop shop. You can come in, you can get your medical evaluation by me, a pain medicine physician. You can have follow-ups with our nurse practitioner. You can see physical therapy, chiropractic services, aqua therapy, potentially speak to a dietitian in the same setting.
At the same place?
Yes.
What about people with mental or behavioral health issues? What can they do?
I'm so glad you asked that question. We have found that almost majority of the patients who are suffering from chronic pain also have coexisting mental and behavioral health issues. So at the Texas Health Pain Relief and Wellness Center, we also have access to psychologists, to psychiatrists, therapists to address that piece of the puzzle as well.
And that's a big piece.
Oh, absolutely.
Doctor, there are all kinds of pain. Back pain, though, probably the most widespread. About 80%, from what I understand, of the people will have some kind of back pain at some point in their lives. A lot of them will take ibuprofen, they'll take Tylenol, they'll get one of those roll-on things, that you can roll on your back, or they'll get a heating pad, they might try something else. And that may work for a few weeks or a few days. When that doesn't work, though, they need to come to see a professional, right?
Absolutely. We all experience backaches, neck pain issues. There is absolutely nothing wrong in trying to take care of this at home in the initial phase, in the acute phase. As long as there's no contraindications, one can try Tylenol or non-steroidals such as Advil, maybe apply some heat therapy, a heating pad, do some home stretches. There's a high probability that your back pain will get better with these conservative measures. However, if it lasts longer than 2 or 3 weeks, my advice is to seek a professional opinion evaluation to rule out something more serious.
Are you seeing any changes within health systems to offer alternatives like you are doing here to pain relief to get away from the opioids?
Absolutely. Generally speaking, physicians, health systems, health facilities have realized that opioids are not the long-term solution. They're actually the problem. Overuse, excessive use has led us to where we are. At Texas Health Pain Relief and Wellness Center, we offer many alternatives, such as physical therapy, aqua therapy, lifestyle modifications, addressing somebody's behavioral, mental health issues. In addition to that, we can also offer interventions. If somebody is having back pain that goes into their leg, something that we refer as sciatica, or if somebody is having neck pain and the pain goes down their arm, this is due to a pinched nerve. Now, we can give somebody a pain pill to take care of that very temporarily, ignoring all the risks associated with opioids, or we can try to do injection therapy and try to cool down the nerve. If we can cool down the nerve, reduce the inflammation, reduce the irritation by doing injections, the patient should feel some relief as well. So there is definitely a change in approach to chronic pain, and opioids are less and less a component in it.
Obviously, a doctor plays a huge role in helping a patient manage his or her pain. But it's important that physicians and other clinicians work together, like what you do here at Texas Health Pain Relief and Wellness Center in Plano.
So just like anything in life, teamwork is very important, and that's exactly what we employ here. We approach each patient with an individualized care plan in a very collaborative manner. If the patient needs to see a pain physician and a neurosurgeon, there's constant communication. Both specialties know what's going on with the patient. Not only that, our center will help expedite a follow-up appointment, and the entire team under the Texas Health Pain Relief and Wellness Center will know what's going on with the patient. This truly is catered towards the patient care.
That will do it for today. I'd like to thank Dr. Haq for joining us. 2 weeks now, 2 podcasts. Thank you, sir. We appreciate it. Texas Health is partnering with you for a better North Texas. To hear more Wellbeing DFW podcasts, visit our website, texashealth.org/podcast. I'm Scott Sams. Thanks for being with us.